Fascioliasis is a disease you may not have heard of, but it affects millions worldwide. It is prevalent in many regions, particularly in areas where livestock farming is common. The disease is often overlooked, yet it poses a significant health risk to both humans and animals. It's a parasitic infection, meaning it's caused by a harmful organism that lives inside the body. These parasites can cause severe damage to the organs they inhabit, leading to chronic health issues if left untreated. In this case, the culprit is a type of flatworm called a liver fluke. Fasciola hepatica and Fasciola gigantica are the two main species responsible for this infection. These flukes are typically transmitted through the ingestion of contaminated water or plants. These flukes make their home in the liver, causing a range of symptoms. The infection can lead to liver inflammation, bile duct obstruction, and even liver cirrhosis over time. Patients may experience abdominal pain, fever, and jaundice. Fascioliasis is a serious health concern, but understanding its causes and symptoms is the first step towards prevention and treatment. Early diagnosis and intervention are crucial in managing the disease effectively. This essay will delve into the world of fascioliasis, exploring its transmission, symptoms, diagnosis, and treatment. We will look at how the disease spreads, the clinical manifestations, and the various diagnostic tools available to healthcare professionals. We'll also examine its impact on public health and the latest research aimed at combating this disease. By understanding the broader implications of fascioliasis, we can better appreciate the efforts being made to control and eventually eradicate this parasitic threat. The parasites responsible for this disease are flatworms belonging to the genus. The two main species that infect humans are and. These parasites have complex life cycles that involve both humans and other animals, primarily livestock like sheep and cattle. Understanding the life cycle of these parasites is crucial for effective prevention and control of fascioliasis. The journey of the parasite begins in freshwater, where its eggs hatch into larvae. These larvae infect snails, multiplying within them. Eventually, the parasite leaves the snail in a form that can infect humans. This form, called a cercaria, attaches itself to water plants like watercress. Humans get infected by consuming these contaminated plants. Once ingested, the parasite matures in the liver, causing fascioliasis. The initial phase of fascioliasis, known as the acute phase, typically occurs a few weeks after infection. During this stage, the parasite migrates through the liver, causing inflammation and damage. Symptoms in this phase can be vague and easily mistaken for other illnesses. They may include fever, abdominal pain, nausea, vomiting, and loss of appetite. Section 5. Silent suffering, chronic fascioliasis and its manifestations. If left untreated, fascioliasis can progress to a chronic stage. This stage can last for months or even years, with the parasite causing ongoing damage to the liver and bile ducts. Symptoms during this phase can be more persistent and severe, including chronic abdominal pain, jaundice, weight loss, and fatigue. In some cases, complications like liver abscesses, biliary obstruction, and even liver cancer can develop. Section 6. Unraveling the mystery, diagnosing fascioliasis. Diagnosing fascioliasis can be challenging, especially in the early stages when symptoms are nonspecific. Patients may present with a range of symptoms such as fever, abdominal pain, and fatigue, which can easily be mistaken for other common illnesses. Doctors rely on a combination of methods to confirm the diagnosis. This multifaceted approach ensures that no stone is left unturned in identifying the presence of the parasite. A thorough medical history and physical examination are crucial, particularly in individuals with potential exposure to contaminated food or water. Questions about travel history, dietary habits, and any contact with livestock or freshwater sources are essential in piecing together the puzzle. Laboratory tests play a vital role in confirming the presence of the parasite. These tests are designed to detect the parasite or its eggs in various bodily samples. Stool examination for eggs is a common diagnostic method, but it may take several weeks after infection for eggs to appear. This delay can complicate early diagnosis, making it essential to consider other diagnostic methods. Blood tests to detect antibodies against the parasite can also be helpful, especially in the early stages of infection. These tests can provide crucial information even before the eggs are detectable in stool samples. In some cases, imaging techniques such as ultrasound Connecticut scans or MRI may be employed to visualize the liver and bile ducts where the adult parasites reside. These imaging methods can reveal characteristic signs of fascioliasis, aiding in the diagnosis. Once diagnosed, timely treatment is essential to prevent complications. Doctors will discuss the best course of action with the patient, which may include anti-parasitic medications and supportive care. Diagnosing fascioliasis requires a collaborative effort between the patient and healthcare providers. Through careful evaluation and the use of various diagnostic tools, the mystery of fascioliasis can be unraveled, leading to effective treatment and recovery. Section 7. Fighting back treatment and management of fascioliasis. The mainstay of treatment for fascioliasis is antiparasitic medications. Triclobendazole is the drug of choice for this infection, effectively targeting and killing the adult flukes in the liver. Other medications such as praziquantel and albendazole may be used in certain cases. The duration of treatment varies depending on the severity of the infection and the individual patient. In addition to anti-parasitic medications, supportive care is essential to manage symptoms and complications. This may include pain relievers, anti-inflammatory drugs, and nutritional supplements. Section 8. Shielding ourselves. Prevention strategies for fascioliasis. Preventing fascioliasis requires a multifaceted approach that targets various stages of the parasite's life cycle. One crucial aspect is ensuring food safety, particularly for water-based plants like watercress. Washing these vegetables thoroughly under running water before consumption can help remove any attached parasites. Water management is another essential preventive measure. This includes proper sanitation and hygiene practices to prevent contamination of water sources with parasite eggs. Additionally, educating communities about the risks of fascioliasis and promoting safe food and water practices are crucial for effective prevention. Section 9. Fascioliasis, a global health concern. Fascioliasis is a neglected tropical disease affecting millions of people worldwide, primarily in developing countries with limited access to clean water and sanitation. The disease is prevalent in areas where livestock farming is common and where humans live in close proximity to animals. The impact of fascioliasis extends beyond individual health. It can have significant economic consequences affecting livestock production and agricultural productivity. Addressing fascioliasis requires a global effort involving collaboration between governments, health organizations, and communities. Section 10. Research and Development, Advancing the Fight Against Fascioliasis. Ongoing research and development efforts are crucial for improving the diagnosis, treatment, and prevention of fascioliasis. Scientists are exploring new diagnostic tools that can detect the parasite earlier and more accurately. This includes developing rapid diagnostic tests that can be used in resource-limited settings. Researchers are also investigating new drug therapies for fascioliasis, particularly those that are more effective and have fewer side effects. Vaccines to prevent infection in both humans and livestock are also under development, offering a promising long-term solution for controlling this disease. Section 11. Conclusion. A call to action for a fascioliasis-free future. Fascioliasis is a significant public health challenge, but it is a preventable and treatable disease. This parasitic infection caused by liver flukes primarily affects the liver and bile ducts, leading to severe health complications if left untreated. The disease is most prevalent in areas with poor sanitation and limited access to clean water. By understanding its causes, symptoms, and transmission, we can take steps to protect ourselves and our communities. Promoting food safety, such as thoroughly washing vegetables and ensuring they are cooked properly, is crucial. Improving water sanitation by providing access to clean and safe drinking water can significantly reduce the risk of infection. Raising awareness about fascioliasis through community education programs and public health campaigns is vital for reducing its impact. These initiatives can empower individuals with the knowledge they need to take preventive measures and seek timely medical attention if symptoms arise. Continued research and development efforts are essential for developing better diagnostic tools, more effective treatments, and innovative strategies to combat fascioliasis. Scientists and medical researchers are working tirelessly to understand the disease better and find new ways to tackle it. One of the most promising areas of research is the development of a vaccine to prevent this debilitating disease. A successful vaccine would be a game changer, providing long-term protection and significantly reducing the incidence of fascioliasis worldwide. Together, we can strive for a future free from the burden of fascioliasis. By supporting public health initiatives, advocating for research funding, and participating in community education efforts, we can make a difference. Let us unite in this call to action and work towards a healthier, fasciolitis-free future for all.